Hello and welcome again to another edition of Calm in the Chair. I am your host, Dr. Vince Monticciolo, and today we have a special guest with us, Dr. Joe Lotfi. He's a dental anesthesiologist that practices here in Florida, a friend of mine, and I've asked him to join us today to give us a little background on what an actual dental anesthesiologist is, what their job is, what their background is, and how we can use them also in our practice and what they do here in Florida. So welcome, Joe.
Vince, thank you so much for having me. It's such a pleasure to be on your show.
Well, I appreciate you helping us out and coming on today. So if you could, for the audience, can you give us a little background on yourself, where you went to school, what your trajectory has been that led you here to Florida and to be a dental anesthesiologist?
Vince, thank you so much for having me. It's such a pleasure to be on your show and to be able to talk to your audience here. Just a brief intro. My name is Dr. Lotfi. I born and raised in Florida. I went to school here for undergrad in South Florida, Tampa, where I got my bachelor's degree, and then I did a 4-year degree in Arizona at the School of Dentistry there. During my third year, I had an experience with a patient. Specifically, we have a special needs clinic. And so we are so lucky, very fortunate. Not every school and program in the country actually has one of those. We strictly treat special needs patients that end up traveling from all over the state. We're one of the only places in the state that has one of those facilities where we can treat special needs for dentistry. And I remember a specific instance where I treated a patient that required extensive treatment, pretty much full mouth. It was something that would have taken 20 appointments, literally. That specific instance, we had an anesthesiologist that was contracted with our program. He comes in once or twice a month, and I happened to be there on a day when he came in. And he said, "Look, let me show you something new." He said, this is not something that essentially is taught at every dental school. And he said, "We can put this patient to sleep." And I said, "What do you mean by that? Tell me more." So gauge my interest. We ended up putting this patient under general anesthesia. Something that would have taken them 20 appointments, like I said, we ended up doing in a few hours, finishing full mouth. This included everything from, and it ranges all over all the specialties in dentistry, pediatrics, endo. So we did root canals. We did an implant, we did a bridge, we did a crown. And like I said, we touched almost every tooth in that patient's mouth. In a single appointment, we finished everything that needed to be done. We saved the patient money. We saved the patient time. The caretaker was very thankful. This patient came from 3 or 4 hours away just to make an appointment, and to relieve them from making 20 appointments was just so rewarding that it put a smile on everybody's face, and including the patient after they were done. They got everything done, and it was fantastic. That to me was so eye-opening that I ended up looking more into depth into this specialty, which is officially coined dental anesthesia. I applied to a residency program, which consists of an additional 3 years of training. And the program that I went to was in Chicago, which I immediately went after my 4th year of dental school. And I graduated in 2023, later to the now officially work in Florida, closer to where I was born and raised. So
Sounds great. Sounds great. So you went from the heat to the cold there in Chicago.
the heat to the cold, and you know what? I love the heat. Let me put it like that. I don't mind not shoveling snow and having my door frozen in my cars. That was great. I do want to touch up on one thing, just because, you know, when someone hears the term dental or dentist anesthesiologist, it almost sounds like an oxymoron. It almost sounds like it doesn't make sense. So the best way to explain this is by defining both of those terms separately. So a dentist is someone who treats infection in the mouth. And an anesthesiologist is someone who is trained in putting someone either under or put to sleep for a procedure, or reduce the anxiety or stress or problems that may be done awake. If you put those two together, you create a patient that has a better outcome of getting their procedure done It's typically done in less time than what someone is being awake. And we mentioned briefly earlier that there are different levels of anesthesia. Now, the difference, a dentist anesthesiologist can provide up to that highest level of anesthesia, which is that general anesthesia level where they're unconscious, they have no awareness, they're completely monitored during the case, and their vitals are controlled by the provider. And in this case, that is something that is being provided in the dental settings. One in like offices like yours, where we can give patients the option to not have to pay that hefty hospital bill. We can bring them to an office or clinic like yours and get everything done that they need to do safely.
The access to care that it allows for some of these demographic groups that you had mentioned, the special needs, the medically compromised, dementia, Alzheimer's, even some of the higher anxiety, PTSD patients that can't be handled by just simple IV anesthesia needs a deeper level, and that's where you come into play. And your schooling comes into play because you really need that higher anesthesia, general anesthesia for safety purposes on some of these patients that are just medically compromised.
Right. Yeah. I mean, having an anesthesiologist on site, it means that you can safely treat patients from crib to grave. So what do I mean by that? It's any age of patient. So like I said, I currently treat mostly pediatric and special needs, as young as 16, 18 months, so very, very young kids all the way up until 100 years old, really. So, it gives you the opportunity to treat everybody safely, um, and all the way up to any complex type of medical history, right? If you're really, let me step back. It really broadens a practice's ability to serve the entire community, including those who might, otherwise have to go to the hospital or a surgery center for care. Right. So you're giving an alternative to patients who just don't have the access. And as we mentioned, it's not everywhere in the US at this time. We're still a growing specialty. And hopefully in the next coming decades, that is something that becomes easier for patients.
Yeah, and I think I think it's even needed more. I see here in Florida. Obviously, I don't want to date myself, but I've been practicing over 30 years. And some of being in Florida, obviously, we see a lot of elderly population, but we're also seeing so many patients that are on different medication. So many patients that are now on some of these weight loss medications that change the situation. Some of these patients that due to medical care, have lived longer than we would have expected them to. So those become a higher risk patient where someone like an anesthesiologist really comes into play for us.
Right. Absolutely. And medicine is always ever changing, right? It's always growing and advancing. There are new medications coming out daily, and you really have to just the benefit of having an anesthesiologist is that someone is pretty much responsible for being on top of that and knowing these up to date advances in medicine and dentistry, and that's the advantage of being both a dentist and an anesthesiologist. You can bring that expertise to your patients, and they don't have to go out and pay these hefty medical bills at a hospital, let alone the wait times.
Yeah, you can't even get into the hospitals now. After COVID, they don't even want the dental patients. The
You're
hospital.
you're looking at like a 2 to 3 year wait list at some of these major hospitals. By then, all the teeth are bummed out, and you have no option but to extract, right? So you put a patient, you put them almost at a disadvantage by having to wait that long. They end up getting the treatment that's not ideal for them.
Yeah, exactly. Even some of the dental schools in Florida, some of the patients, we try to refer them to Shands, UF or whatever, and there is an 18-month wait, and the process to get through the dental school is really arduous. I mean, it's tough on these families. They can't make all those trips. Allowing them to be seen in our office with the specialty care of an anesthesiologist is really the highest level of care we can give them. Our practices, we do bring in a dental anesthesiologist in a couple times a month. and it is to treat those specific patients, mostly the higher risk patients, some of the special needs that I'm not able to treat, some of the Alzheimer's or dementia patients that need specialized care, or the really advanced medical patients, like you said, that are either medically be riskier or need more attention. Where an anesthesiologist that can intubate or that we need in the office to handle those type of patients. As you know, we're building the Sedation Surgical Center coming up in the next year, and that will allow us to bring in an anesthesiologist like yourself and treat pediatrics also. So right now we get calls daily to do the pediatrics, and we currently don't see them because I don't have a daily anesthesiologist, but that's going to change. So, we're looking forward to utilizing the services of a dental anesthesiologist on a daily basis, pretty much for the safety and care of our patients, and to be able to treat the full array of anesthesia. So one thing I wanted you to touch on is the advanced safety protocols and maybe standards that an anesthesiologist not only has to maintain, but also um, making it less risky, with some of these patients. So in my case, the patients are, still breathing on their own, whereas in your case, you're breathing for the patient. Is that correct?
Of course, of course. So, with you mentioned safety protocols and and monitoring standards, right? So safety is absolutely at the core of what we do. We follow the same monitoring standards recommended by both the American Dental Association, or ADA for short, and the American Society of Anesthesiologists, or ASA. So what does that mean? That means that we have continuous monitoring of oxygen levels, heart rate, blood pressure, ventilation, and your ECGs throughout the whole procedure. And we also have, on top of that, emergency medications, airway equipment, recovery monitoring protocols in place, just like you'd find in any hospital setting. Our goal is always to create a controlled, predictable, and safe environment for every patient.
Yeah, that's great. That's great. Um, as you know, I know, but maybe our listeners don't know. On a lot of cases, especially the patients you're seeing now, the pediatrics on a daily basis, you're actually intubating to make it a safer procedure. Is that correct?
That is correct. That is correct. Not everybody does that. There are different levels of sedation, so maybe I'll touch up on that briefly
Sure.
here.
Please.
But essentially, there's four main levels of anesthesia. What we call it in the most generic way possible, or easiest way to put this in is there's a minimal sedation level, right? And that includes the patient essentially being awake. They are responsive. The ideal effect is to create a little bit of reduced anxiety with that level of anesthesia. But however, like I said, they're still awake, still conscious, still responsive, maybe a little bit of drowsiness, but reduced anxiety is the goal of that. You then have the moderate sedation level, okay, and this is where the difference between an anesthesiologist with the residency training and this level of anesthesia kind of kicks in. So in this level of anesthesia, you have patients that become drowsy. So they may not respond to verbal commands. Again, these are all medication induced, but you have the patient still awake. Okay, it's just a little bit more drowsy, a little bit less responsive than to minimal sedation. Your third level is that deep sedation level. And deep sedation is more of, also termed in anesthesia as monitored anesthesia care, or MAC. It's referred to also as a twilight, and it's typically given through IV. It is an unconscious form of anesthesia. Usually patients are unresponsive. However, their breathing still is spontaneously done. So they're not on a ventilator typically. Breathing on their own, they may require some assistance. However, they're still doing most of the work on their own. Then you have the fourth level of anesthesia, which is that general anesthesia, which is typically what an anesthesiologist specializes in. And that is what the additional training is typically for, is mastering the skill of that final stage of anesthesia. That includes unconscious level of activity, no awareness or sensations. Your vitals are typically completely controlled by the anesthesiologist. And some of your common vitals, your heart rate, your blood pressure, your temperature, your oxygen levels, things like that are involuntarily controlled. So you're creating an induced coma for someone that you then have to monitor during the whole procedure. Often you use a monitor or a machine termed as a ventilator that allows you to control the breathing for a patient. In certain cases, medications are given through the IV, and as we mentioned earlier, patients can be intubated in this level of anesthesia. So their ability to breathe is essentially controlled or monitored by the provider. And that is a big difference between the other three levels of anesthesia, is that this is non-arousable. Unless properly trained, this level of anesthesia has the highest risk of complications. So that's why we do a 3-year residency training in how to manage some of the emergencies and the airway training to make sure that we not only put the patient to sleep safely and wake them up safely. And nowadays, anesthesia has come so far, it's actually very safe. And that's a big misconception that comes into anesthesia is what are some of the adverse effects or what are some of the problems? Anesthesia today is extremely safe compared to how many people actually have problems and how many people do very well. You have a higher chance of getting struck by lightning twice. So let me put it like that.
Yeah, I know from my training that the dental anesthesiologist obviously is the highest level of anesthesia care that we offer, and it is extremely safe. However, the public usually hears the horror stories that the news programs release about complications, and as you know, a lot of those complications that we see out in the real world are actually cases that might not have been managed or intubated or handled by somebody at the level of your care or your studies. So, you might want to touch on that, we hear a lot about, open airway on pediatrics or death here or there around the country.
No, that's a really good point. I think, depending on levels of training, there's definitely different ways of doing anesthesia. Several of them are correct, but some of them are also wrong. So what do I mean by that? Let me touch up on certain kinds of training. There's the residency training level, which comes at a 3-year program. And then specifically for dental anesthesia, you do dental school first, and then you do your training, which is typically hospital-based. And then it consists of several rotations throughout different populations of patients. So including geriatric patients, special needs, pediatrics. So you focus on different groups of people during your training. You learn what can go wrong so that you can prepare to be 5 steps ahead. Now, there are other levels of training where, of course, it's possible to take a weekend course and you provide like a minimal sedation level, which is that very first level of anesthesia. And for those types of anesthesia, there's a very fine line in terms of moving into the next level of anesthesia. And I think that's the difference between someone who's residency trained and not, is that knowing your boundaries, right? And it all comes down to your use of medications, your training in how to determine what can go wrong with those medications and how to treat them. So if something were to happen, what would you do? And just the varying degrees of training comes back to what level of sedation you're comfortable with and you're trained to adequately be prepared in case an emergency happens. Like I said, though, today anesthesia is very safe, relatively speaking. And it's come such a far way in the past, century. And anesthesia has actually been around for a long time, surprisingly, since the 1800s. One of the first anesthesiologists was a dentist. And it's been passed through. So this is a very old career actually in dentistry, surprisingly, older than it is in the traditional physician route. So the dentists have been doing anesthesia for a very long time.
Yeah, that's wonderful. And I know at your level, obviously, you have to maintain your certifications, advanced cardiac life support, and all the training that you have to do on a 2 or 3 year basis to stay, certified. Is that not correct?
That is correct. So we do typically hold your standard BLS, ACLS, PALS, and emergency airway certificates. That is correct. And they're renewable. I think it's every 2 years now.
Correct, correct. That's great. That's great. So, if we could touch base on how, especially in Florida, a dental anesthesiologist would kind of collaborate with dentists, because you're at this higher level, you actually no longer do typical dentistry. You're just doing anesthesia for dentists. And I know you're where you're working. You're actually dealing with pediatric dentists on a daily basis, but a lot of dental anesthesiologists will work with general dentists, pediatric dentists, oral surgeons, even though they can do general. If they're doing a large case that's on a riskier patient, they'll bring in an anesthesiologist just for the safety and the care. So, how does a dental anesthesiologist in Florida kind of work with the other group of dentists that are available?
So collaboration is really at the heart of what we do. Before every case, I typically meet with the dentist or the surgeon, depending on the case, and we discuss the patient's needs. What are the goals? What needs? How do we accommodate this patient? Every patient is different, so it's a really case by case, and it's something that you can't really generalize for everybody. And that's why it's important to have that open communication with your provider. You're a team, right? So I go into this understanding the patient's medical background. That's number one. What's the goal? What's the treatment plan? What's the end result? During the procedure, I handle the anesthesia so that the dentist can focus entirely on the dentistry. That's the goal. It is the true team effort there, right? Everybody has their part, and they should be focused on what their part is so that they can give it 110%. Afterwards, in my case, we do review the case in the recovery process, ensuring continuity of care. Specifically at the place I work at, we have a nurse that does help us with the anesthesia. We set the patient up so that they're ready for, the optimal treatment. The dentist comes in, does the treatment. We then wake up the patient. We have a dedicated recovery room, where the patient then recovers for about 30 minutes. So it's anesthesia actually has a pretty quick turnaround in dentistry. And then, so like I said, open communication is very key so that everybody knows what's going on. It's what makes the experience essentially seamless for both the provider and the patient.
Yeah, that's wonderful. That's wonderful. You know, having an in-office dental anesthesiologist would allow more access to care for some of these demographic groups that really have a hard time finding treatment. I know just doing moderate sedation that patients drive hours just to come see me. We can handle most of the cases, but a lot of them require a higher level of care with an anesthesiologist. Because there's limited amounts of dental anesthesiologists in Florida, a lot of these patient groups are having a hard time finding access to the proper care. A typical dental office obviously cannot handle the special needs patient, cannot handle the gaggers, cannot handle, the medically compromised patients, the dementia patients, the high anxiety PTSD patients. These are all, require anesthesia, so allowing a dental anesthesiologist to come into a practice that's prepared and has the monitors and the machines for that would open up a world for all these different patient groups to have access to care. What do you think of that?
Oh, absolutely. It's huge. I mean, just helping and increasing access to care. I hate to say it's a relatively new concept in our area. Although dentistry has had anesthesia, um, like you said, sometimes there are patients that are driving multiple hours to find a single place that offers that service, right? So many people avoid dental treatment in general because of fear, past trauma, sensory sensitivities, and those patients often delay care until the pain is infectious and forces them to have to go into the ER. We've seen that numerous times. And by having an anesthesiologist available, we're able to not only treat those patients comfortably, but in office. So they don't have to pay these absurd hospital bills to be able to be seen. It's relatively affordable, and it reduces anxiety. It prevents more serious dental and medical problems down the road, and it bridges a major gap in oral health care.
Yeah, I agree. And the relief for some of these families that are really, some of them are burdened, not burdened trying to find a provider for their family member, or if they're the caregiver of a special needs or a dementia patient, they're really kind of beat up and happy to find somebody that can provide this kind of care under the safety measures of an anesthesiologist. On a couple more points, I just want to touch base on what are some of the misconceptions people say, I just want to go to sleep. Well, as you mentioned, there's all different kinds of levels of going to sleep, whether it's just minimizing the anxiety or it's actually breathing for the patient. And, a lot of people don't quite understand that. Obviously, an oral surgeon can give them anesthesia and extract a tooth, but the oral surgeon can't provide a root canal or a crown or things of that sort. By having an anesthesiologist that can sedate the patient at any level that's necessary, the patient can have, like you mentioned, your dental school experience. They can have all their work done in 1 or 2 appointments and not only be out of pain, but not even recall the appointment. So that's one of the advantages of the anesthesia is they'll have no recollection of their appointment or the care that was done or the time it took to do it. Is that not correct?
That is absolutely correct. No, well said. I think just to add on top of that, one of the biggest misconceptions, and I briefly mentioned this earlier, in anesthesia is safety. Is it safe to do anesthesia in the dental office? And really, the idea of anesthesia is to be 3 or 4 steps ahead. If you have a provider that has that mentality and that training, it's relatively safe. So if it's administered properly by a trained provider with the right monitoring, like I said, it is very, very safe. Safe. You have a higher chance of getting struck by lightning twice than having a crazy reaction in anesthesia. Another common thing that I see or I hear in anesthesia is that patients typically feel terrible afterwards or may take days to recover, and that's simply not true. And this is based not only on experience, but by medical evidence-based dentistry. Um, Most patients, as I mentioned as well, have a short recovery period. After a dental case, it's typically a 30 to 40-minute recovery, and they're almost back to their 100%. You give them another day, they wake up after having a nice nap, and they're a new person, right? You also mentioned that they don't remember the experience, and at the general anesthesia level, when they're completely asleep, they have no recollection or sensation of the procedure itself. So not only do they feel nothing, they don't remember going into the room, and they wake up at the snap of a finger. It almost feels like it was that quick. It feels like they were counting down backwards from 30, and they wake up with not realizing how much time has gone by and the focus and care that they just received. The whole experience is designed to be smooth, controlled, and comfortable. And that's what patients receive once they get their anesthesia and dentistry put together.
Yeah, it really is. Patients call it magic. It's not magic, it's science. It's science, and it's great because, I know there's a lot of medications that we also add to the IV mix, something for nausea, something for discomfort, something for swelling that can all make that experience, so much better for the patient when they do wake up and they don't remember it and they're very comfortable. Some patients say even better than when they went under because you're removing all that infection, you're removing all those complications, and you're removing all that stress and anxiety that they had gotten so worked up about that had taken them a while to show up. So, Doc, I just want to give you a chance here. If there's anything that I missed, anything that a dental anesthesiologist wants to get out there, either to the general public or to a provider like myself that I missed on, to kind of explain the advantages of your profession.
Sure. So our goal is to make dentistry possible for everyone, regardless of age or medical history. Safety is the number one priority, and we want to make sure that everybody has that opportunity to get the treatment that they need with the access to care. And unfortunately, right now we're in that transition period where we're trying to become more available to everybody. There's just not enough of us to go around. And once we get to that point, hopefully in the next coming decade, as more anesthesiologists graduate from both the medical and dental side, that the option is more available to patients. Like you said, there are patients still driving 3-4 hours a day just to get treatment done or be seen. And hopefully it's done in 1 or 2 appointments. Luckily, in this area, in your area, you are creating something new. You are creating an environment for patients to be seen. It's not like that everywhere in the U.S. And once, my goal is to promote this more so that more people have that interest in becoming an anesthesia provider and offer the services needed for these underserved populations. It's you go to middle America and it's unheard of in states. There are some states that have 0 dental anesthesiologists or 0 anesthesiologists in general that are focused on dentistry. So there is no access to care. And unfortunately it's not like that. We're lucky here in Florida. We have someone like you who's able to, create this opportunity for patients. And one day we hope that's in all 50 states.
Yeah, that'd be wonderful. We're trying to do our part, obviously, making a little dent in the universe here and trying to make an impact on those groups. It is pretty rewarding and very, very gratifying to help some of these providers and caregivers of some of these special needs and dementia patients. That's my most gratifying part of the practice is, being able to help some of these special needs kids. It's just great. So, we get a lot of tears and a lot of hugs from some of these kids that make it all worthwhile. So
It really is. Oh, it's so rewarding. It's so rewarding. People don't realize how much until, I've heard stories where people drive for hours because we're the only person that they see or that's in their area. And we're the lucky ones to be able to treat them honestly. So
yeah, it's great. I appreciate your time today, Joe. We all appreciate you here in Florida. I appreciate your friendship and I appreciate your profession. Obviously, hopefully in the future, we can do some things together. I want to thank everybody for joining us today. If you have any questions or concerns, obviously you can reach us at happydentistry.com. And until later, keep smiling. Thanks again.
thanks for having me, Vince.